Hi there, Marion Barnett, cancer movement therapist, coming to you during the month of May, talking to you about shoulders and all things shoulders. And one of the things I want to talk about today is how shoulder movement will affect your neck as well. So, after surgery, during treatment, there may be a lot of reasons why the pain is not only in your shoulders, but also in your neck as well. First of all, I hope you're resting and recuperating, and that means that you will be lying down or resting, maybe not even in the most comfortable of positions, and that can certainly have an effect on your neck. But also the muscles that can come through from the neck and into the shoulders will change their position because of where your shoulders are. So that lack of mobility and that change in how the shoulders are moving will affect how your neck is moving as well. So if those shoulders are forward, you can see my neck is going to come forward as well, putting a strain on some of those muscles in the front. As well, if when we're moving, we're very guarded, which of course, after surgery, through treatment, you will be guarded, you'll be tight as well. There may be changes, and let me just switch position here, in the upper back. So if you're rotated forward here, that mobility through the lower neck and upper back, that thoracic spine, is going to change because of that shoulder positioning. And again, I'm exaggerating that rotation. You may have a lot, you may have a little. Again, everyone's different, but that mobility will change and it can affect the neck as well. So I want to go through and talk to you about checking that neck position, because the optimal will be to have the ears over the shoulders and the chin at a neutral position. So again, if you're lying on the couch, if you're lying in a chair, watching TV, reading, watching Netflix, all the things you should be doing when you're recuperating at the beginning, watch where that position is and change. Watch where that angle is, and if you can, stand in front of the bathroom mirror, take a look and see if you've got ear over chin, chin in the center, and seeing that, does it look side to side or does it look fairly straight? We're not going to be 100% perfect, of course. Things are going to be different, but can you get that ear down to the shoulder? Can you get your chin over to the shoulder? Can your chin come down to the chest? Can your chin come up to the ceiling? So again, the neck has a lot of movement. That's why it can get tight. We're used to spinning our head around all the time to look. So again, let's go through those. I want flexion, chin to chest, extension, chin to ceiling, ear to shoulder. Now again, that's lateral flexion. When you do this, do that one in front of the mirror, okay? I need you to make sure your eyes are staying in the front. So keep the ear over the shoulder with the eyes in front. Don't let that drop down. I want those muscles to stretch on each side. And again, if there's any risk factors, if there's osteoporosis, if there's fusions, if there's any pre-medical issues, or you've been told not to mobilize your neck, then we're not going to do these. If you're cleared, then by all means try these out, because the mobility and the stretching here is going to help overall with feeling less tight, more mobile, and less pain. So with the rotation, and that's the chin to the shoulder, I want you to go sideways. Mirror is on this side, and I want you to turn and see that you can see the eyes in the mirror. We're not crooked, we're not dropped. I want those eyes to come into the mirror, both sides, and then you can see that you're moving the way your neck should be, and you'll also know what's tight and what you need to work on. If you have questions for neck range of motion and you need some neck mobility exercises, send me an email, give me a Zoom call, let me know. We'll talk them through and we'll see exactly what you need to do. Again, thank you so much for joining me through the month of May for shoulder mobility, all things shoulders, and learning how important they are because they affect a lot of different areas of the body.